All right, hey guys, Happy New Year, happy 2024. Super excited for this year. Um, we've been getting a lot of questions about lipedema, a lot of interest about LippyLipo. What are we doing? How will we doing that? And as I was going over like tons of before and afters that we have on lipedema, one thing that kind of struck me is our patient here. It's kind of like when you look from the side on lipedema patients, the first time where you see the knee itself sitting in front of the thigh and that. If you look at her before, you see kind of the fullness of the thighs, it hides the knee. So the thigh is projecting in front of the knee. But after LippyLipo, that's what happens. Kind of laying back, you see kind of like nice smooth skin comes to the knee and it goes down to the shin and to the ankle. And this is key, and that's kind of the beautiful about the 360-degree approach that we're doing with LippyLipo. It's really showing the knee as a knee complex. So it's not hiding under the fullness, the lipedema fat from the thigh area. And you can see it kind of like all the way down to the ankle. You see the ankle bone here. Over here, you see there's no ankle bone. It's like totally hidden by that fullness here. You see the light reflex that you have. And really look how nice and smooth that skin is. This is like one day after the procedure. You see kind of like those tiny dots. You see kind of a little bit of like, you know, like the tinged blood because she's oozing after the procedure, and that's good. And these, they fade away over the year. But look how nice and smooth that contour is. And again, like with one procedure going from here to here, immediate outcome after the fact. And that's why like I'm a huge fan of LippyLipo. Again, LippyLipo, a few things about it. It's like, how are we consistently able to get these results? It's really by getting the awake LippyLipo technique. What's special about it? Microcannulas, immediate outcome, 360-degree, awake, safe, minimized complication rate, and it's really been a game changer. I see one question here from Janil that's asking, you need to show the after picture with the patient standing up, not lying down. And that's great. We got a lot of patients asking, well, standing up versus laying down. And well, we have tons of patients sitting up and standing down. The key is when they are sitting down, it gives you an idea of like how it is. When they are standing up, it also gives you an idea of how it is. And let me kind of see here, if I can scroll, we do have let me see if I can a picture here standing up. Well, that's another picture I have here. Let's do that. That's standing up. And again, the key is a lot of people, and they should, you know, they're like, we don't know. I mean, are these results are really so good? Maybe he's faking it. He has the patient lying down, but let's see standing up. And you see like this patient 1 year post-op standing up, and look at that. And let me tell you, afterwards, laying down, she looks great. Standing up looks great. Well, if somebody is not looking great laying down, they're not gonna look great standing up. You know, and that's kind of like part of it. Really, the main difference is how the skin is gonna evolve over the next few months. So that's another patient here, 2 months post-op on a stage 4, and you can see like it goes from here to here because you maximize on 5 liters on those. And again, like it really, I'm with you. You gotta see standing up just to see. But I'll tell you this: we've done hundreds and hundreds of these searches. When patients are looking so good immediately on table after, they're gonna look so good standing up at 1 month, 1 year, 2 years, 3 years, kind of as you go. If they don't look good on table immediately after, they're not gonna look good after that. So I know a lot of people ask about standing up and that. In my experience, I haven't seen where the patient, they looked so good standing up and they looked, so good on table at the end, and they looked so bad afterwards. It's just like, it's impossible, because it's like, you know, the shape, you're gonna see it. And it's lipedema. It's not only the shape, it's the cosmetic, it's the functional, it's walking, it's preventing future progression. I mean, it's like all that stuff together. But again, and I keep going. I mean, I have tons of like before and after. That's another one, like you can have here. That's laying down. Now some people say, oh, I wonder how she looks standing up. I'll try to find the pictures, and you see kind of like, again, like beautiful shape of the knee, beautiful shape of the thigh. You can see here, there, this, that. Again, one day you can still see like, you know, the tumescent fluid coming out, some bruising. That's expected the first week. And this is kind of how she was before. Again, amazing outcome. And then people, oh, how is she going to look standing up? I'll tell you, she's going to look great, because she looks great the way she is. Now, if you see a huge contour irregularity here and a huge cut and the skin is like rippling and that, guess what? It's not going to look good standing up. So let me keep on going. I'm going to choose another one. The cool thing this weekend, I went through, we have hundreds and hundreds of lipedema cases, right? So we have a ridiculous amount of before and after that you can use. Again, take a look at this one here. Look at the width of the leg compared to the other side, and look how awesome she's looking. Same, look at that. Beautiful. Same, beautiful. It's really, really awesome. Again, great outcome, nice smooth contour. You can take somebody who's like stage 2, 3 lipedema and get them to that in one procedure. That's impressive. Most of the time, we are maximizing on 5 liters. Right? You cannot go more than 5 liters. It's not safe. It's not it's against the law, and that's the right thing. This is good because safety is key with LippyLipo. So most patients, they need 2 procedures, one from ankle to knees, 360 degree, and the other one is like knees all the way to the thighs. We're staging these procedures. A lot of patients are out of state. They fly to us. We do that first stage on Monday, the second stage on Friday, and then they fly back on Monday. And that's kind of like, they spend about a week, we do their 2 cases, and then they go. If they have more than 2 procedures, late stages, they can, like stage 3, 4, they might have 3, 4 procedures. Then on these cases, we do Monday to Friday, have them recover for about 6 weeks, then we'll have them come back, and then we do another Monday and Friday, and then they will be done with their lipedema to the legs. So that's kind of like, that's how we advance it. Let's see, we got like a few questions here. I love these sessions, guys. So I love LippyLipo, I love lipedema. So ask any questions you have. You know what? Let me put it in the comment section here. Ask your questions below. Okay. And let me pin it. Perfect. Awesome. All right. Sorry about that. Okay, I've got a lot of people joining here. Let's kind of take a look. We answered kind of standing up versus laying down. And again, that's a good question. People, they want to, because that's the thing, you want to be consistent. Like we are, it's like, we're like almost guaranteed. We know exactly where we take a patient from point A to point Z. Again, we've done so many of those. That's all what we do at this point. We're so consistent. We're so certain from getting people from where they want to there where they want to be. The last thing we want to do is like, oh yeah, you're going to look great and you don't look great. Or, we're going to remove this and that and we don't do it. Because, it destroys our brand. So it doesn't do us any favor. And that's why we have like great reviews and great patients. They keep on coming back to us. Someone is asking, how do you decide how many surgeries a patient will need? That's a great question. The least you're going to need 2. Stage 1, even if you don't have much, most people, they have more than 5 liters because you're talking about the ankles, the calves, the knees, the thighs, inner thigh, outer thigh, saddleback. Most people have more than 5 liters and the most you can take out is 5 liters. So almost everybody with lipedema, they're going to need 2 stages. Okay? Now, if they are late stages, stage 3, 4, that person might have 10, 15 to 20 liters of lipedema fat. And you cannot take out more than 5 liters in one setting. So let's say if they have 15 liters, they're going to need three procedures. And that's why in every surgery, I try to maximize to get them to that 5 liters, because especially if they need more. And the last one, we get to as much as we need, and then at some point you have to stop. The mistake also is, let's say somebody has 17 liters. We did 3, 5, 5, 5, 15, and that's 17 liters. Within that case, we're taking 2 out, but actually we want to get 5, so the patient feels that we're getting the most. That's a mistake, and that's what I see when people are sending me that stuff, you don't want to over push it, because over taking out fat cells creates contour irregularities, skin graft appearance, change in color, and that's unfixable. So that is a sweet spot where you want to end, and that's where expertise come into play. So it's the 5 liter on the first few surgeries, but on the last surgeries, the end point is not the 5 liter, the end point is the contour, the shape, how it's looking, and that's where you want to stop, not hit to the 5 liters. That's a common mistake like newbies do when they are doing the lipedema. And talking about kind of like, you know, revision and stuff like that, we are not accepting any revisions or any from outside surgeons. So if someone has that surgery done by somebody else, we're not accepting patients for like revisions or touch-up or stuff like that. We will take care of our patients, and the reason for that, because we are so booked with our own LippyLipo patients, and it's just, it needs to be done right from the get-go. So your first procedure has to be, it's like building a house. You gotta have good foundation, good infrastructure, and then you build on top of it. Same with lipedema surgery, same with LippyLipo. If we don't have a good foundation and people built on sand, it's very hard to fix the house and you have sand under that house. So it's very crucial, like do your homework, know who you're going to, and that's kind of like, it's very, very important. Again, like these cases, it's very hard to get these outcomes. It takes a lot of expertise. Getting this awake, safe outcome, it just make sure you do the homework. That's for summer. We answered that question. Richard Christie is asking, how painful is it? You know, during the procedure, there's 3 types of patients. And again, we've done so many of these, we cannot tell. And I can tell probably in the first minute of the procedure at this point. You've got the patient that's, you know what, oh, it's easy, it's simple, you do the numbing. Now the lipo doesn't hurt, the part that's standard to certain people is the numbing part. Now some people on the numbing, they're like, oh, it's easy, I don't feel anything, it's like perfect. Some people, it's like, oh my God, like it's really tender, it's that, they're sucking on the pronox and you feel like they're having a hard time. So 10% they don't feel anything, 10% they're like, oh my God, it's like really painful, like they hate that first hour of the procedure. And you've got 80%, they're like, oh, okay, not too bad, here and that. So it's like, it's a bell-shaped curve. And again, we've done it so much. And I can tell by just injecting the numbing to start making those tiny little holes to enter the cannula, I know what the pain threshold is for the patient, and then we walk through them. We use vibration, Pronox, Xanax, this and that to kind of like, and now we're looking into something that's really cool, kind of like digital, anxiolytic, using VR and other stuff. So, but we'll talk about that kind of like, it's in the works currently. I think that will be something cool for our lipedema patients. Manal Amar is asking, how many liters can you remove each surgery? 5 liters. This is the most that you would hit, and you don't want to bypass 5 liters. Even 5 liters, I mean, it's like it's at the edge of going high volume liposuction because of the fluid shift. It's a fluid shift on the heart, on the lungs. Over fluid is a problem. So you just want to basically, with already like, to get to 5 liters, you're injecting more than 5 liters in anyway to tumescent the stuff, and then you get, so you're talking about like probably, let's say if you put 8 in, 5 out, it's about 13 liters of shift on a patient. So that's a lot. So any more than that, really that person has to stay admitted to the hospital in an ICU, making sure like all the fluid does that. Some of them, they have folic acid. It's just totally not worth it. Again, LippyLipo, 5 liters, do it safe, do it the right way, you get a great outcome, you'll have a great experience. Great questions. Janilda is saying, okay, next time the before and after needs to be the same pose. Good point. I mean, again, ideally, yes, you want to have like perfect before, perfect after, and I'll probably share that with you here. Let me see if I can find the same pose on the before. Okay, there you go. This is one. So if you look at this one, these two actually, this is the before, this is the after, and it's the same pose. This is the before, this is the after, and it's the same pose. So, I mean, that's, you're right, like you want to have the same pose, the same lighting, even the same person taking the pictures. But again, here we're trying to show what we have, raise awareness, and kind of get them to where people want to be. And again, we're very selective on who we choose. We feel like if we feel like we cannot get what the patient is looking for, we won't accept that patient as a patient. So we want to make sure like it's a harmony when you look for your surgeon. You got to make sure that that surgeon is who you, it's a partnership on both ways. So so that's why like you gotta do your homework, you gotta make sure that you connect to the person, and also you wanna have realistic expectation. And that's something like along physicians that we talk about a lot. Like if we feel somebody doesn't have realistic expectation, if you are going to the right surgeon, they will not take you on as a patient, because we want happy people. We wanna give them the best outcome possible, the best experience possible, and we want people to be happy. And if we give them a great outcome and we give them a great experience, and the patient is not happy, it's a loss on our end. And the loss is because we didn't select the right patient. So it's really mutual on both ends. So as a patient, you gotta be also take a look at it, stand outside of it and take a look. It's like, okay, how can I get the best outcome possible, the best experience possible, or the best surgeon possible? And that's kind of where you want to be. And at some point, it's not a magic wand. You cannot like push beyond, like let's say we take 30 liters from the thighs, and somebody wants like to have like nice tight skin without any skin resection. It's not gonna happen because it's not a magic wand. Guess what? You take 30 liters out from the thigh, you're gonna need a thigh lift at the end of the procedure. It's just kind of like that's how the body is, and knowing what you're getting into is so crucial. All right, good questions. Keep on going here. Since you do not do more than 5 liters from Namniato, is that why it's safe for patients to not have to stay overnight? Stats post LippyLipo for fluid monitoring due to fluid removal. Stop surgery. That's a very good question, and you're absolutely right. Whenever you want to go more than 5 liters, you want your surgery to be done in a hospital setting. You wanna be admitted overnight to stay in, because the chances of complications go significantly higher once you go beyond 5 liters. So for example, the state of Florida is 5 liters. It's 4 liters in office. In Kentucky here, it's 5 liters. In most of the other, across, it's 5 liters. You go more than that, it's not safe. You gotta be in a hospital, you gotta make sure you've got like ICU set up. Some people who do high volume, they immediately admit the patient to an ICU setting. They have a Foley catheter, they have line, they're monitoring their fluid replacement. It's just like, it's a lot to go in whenever you wanna go more than 5 liters. To me, it's just not worth it. The risk outweighs the benefit. 5 liters gets you to where you need to be safely. It's like driving on the highway. If 65 miles per hour is the speed limit, drive at 65. Because God forbid you have a crash, the chances of being okay is much better than driving 120 miles per hour, like 5 liters versus 10 liters, like the 130 miles an hour. The odds of something really bad happening, a crash at 130, is much higher than a crash at 65. Most of the times you're not gonna have a crash, but that's why it's like, you gotta really understand what you're getting into in each procedure to get to the best outcome possible safely. Safety is so crucial. And the other thing I like, the staging it on my end, is the skin has more potential, more likely to redrape better than the skin where you totally deflate 20 liters at the same time. The odds of needing skin resection on that skin much higher than if you do 5, then 5, then 5. Just like the collagen has more room to redrape than just deflating it all at once. Excellent question. Manal is asking, so you can do upper legs and lower legs within the same week? Yes. So normally we start with the ankles, and we go all the way up to the knees on Monday, and we get until we hit 5 liters, and then on Friday we kind of finish that. So basically, let's say this patient, so you go basically from here all the way up 360 degrees to do like ankles, calves, and knees, and then you go from here all the way up 360 degrees to finish. And most of the times we're getting around that 10 liters. Now, advanced stages, they will need more, and then we give them 6 to 8 weeks apart have them come back, and then we do the rest. Again, for safety. Could you do it 2 weeks back to back? Probably you can, but the chances of complication goes up. And the last thing we want to have is we want to minimize any chance of complication. We want to keep it extremely, extremely low. And again, we've done so many of that. We've had people like, you know, they need albumin, fluid, this, that. Now we kind of like, after figuring all that out, I mean, we really minimize. It's not zero, but it's like close to zero. Just because we do it like certain way consistently every time, we reach the point where, I mean, that's like 99% we're certain that's what we're gonna get. And we're like consistent with that and certain. Created by Kathy saying, you're so amazing at what you do. Thank you so much. I am so passionate about, I dedicated my entire life at this point for LippyLipo. I mean, that's like all what we do. We get so many people like begging us for breast augmentations, tummy tuck, like all sorts of stuff. And we're like, all what we're doing is like LippyLipo at this point, just because I'm so passionate about it. And the outcome is impressive. Patients are so much happier with helping from a functional standpoint, from a psychological standpoint, from a cosmetic standpoint. I mean, the satisfaction is so huge. And again, like we still have finishing the old surgeries that we booked from before, but all new patients, when they come in, it's LippyLipo, it's awake lipedema liposuction. That's all what we're doing. And again, I mean, it was a big, tough decision, but it's been awesome because like you can tell I'm so excited about it because I love it. Alan's asking, when can you walk after the procedure? Immediately. So again, that's the beauty about LippyLipo. Like you walk out of the procedure to your car. There's no wheelchair, there's no sitting in bed. So, and we want you to walk. Walking is good. It's gonna make you feel better. It minimizes the chances of any blood clots or whatever, even though it's like so minor with awake, like because it's not general anesthesia. So you'll be walking like after the procedure. And we want you to kind of keep on walking. Created by Kathy, you're like the lipedema whisperer. Pretty much, yeah, I think so. You know, it was like New Year, New Year Day, and like this entire weekend, my wife was like, "What are you?" I was going over the before and after, getting the Excel sheet, like trying to figure that out. And again, I didn't have to do it. I was doing it with like a big smile on my face because I love it. And big things are coming our way to our like future patients in terms of making the experience better. So I love it. I do. Belen is asking, what about any skin tightening techniques after removing the lippy fat? Absolutely. Every LippyLipo finishes with skin tightening, and that's part of the reason we're getting this amazing outcome. Even though like we don't talk about it, but when we're doing LippyLipo, we're doing mechanical skin tightening on every single patient at the end of the case. At the end of each area, we're doing mechanical skin tightening. We're redistributing the skin, we're stimulating collagen from the inside, we're doing all that stuff. As you guys know, I'm not a big heat guy, I'm not a big guy that I'm worried about lymphatic injury, about skin injury, discoloration, all that stuff. We're already like doing a lot on the patient. Mechanical, it's like microneedling to the skin, like healthy, organic way of stimulating collagen to get the contour that we want. So the answer to your question, every patient, even if they are stage 1, we're doing, and you know the skin's gonna do well. With LippyLipo, we're doing mechanical, organic skin tightening. Someone is asking, do you do arm lipo as well? Yes, so we do, and the arms are tricky. The arms we do, when we do the arms, most lipedema patients, not only the arms are involved with lipedema, the arms, the elbow, the inner aspect of the elbow, they have a fat pad here, and some of them, it carries all the way down to the wrist. Now they don't know about it. As I'm examining them, I'm like, I'll pinch here, and then you can pinch the lipedema along that pinky finger. That's where the lipedema fat cells sit. So we do liposuction 360 degree to the arm, 360 to the elbow, 360 to the arm. I mean 360 to forearm, 360 elbow, 360 arm, and so important, do the axilla here and that upper back area. Because the last thing you want to do is treat the arm, and now people have bulges here coming out from clothing. So really you gotta shape it very well. So with every LippyLipo we're doing to the arms, we're doing forearms, elbow, and kind of the upper back and axilla area just to shape it so that when they put that hand down, we have no bulges coming from the outside. And that's crucial. Same with LippyLipo, we're doing skin tightening to the forearm, even though the skin, most of the time they say, well, even to the arms. The arms with lipo, with LippyLipo, they actually do much better than the thighs. Knees, calves, ankles, 90% plus, the skin does very well. The thighs, when you take more than 10 liters out, you're kind of like, let's see how the patient's DNA are and kind of how they will do it, even with skin tightening. You take more than 20 liters, you're going to need skin resection. More than 100 pounds weight loss, the thighs, they're going to need skin resection. The arms, they do much better than the thighs. Much less chances of needing skin resection on the arms with patients with lipedema than with thighs. Good question. The woman of the piece is asking, where is this doctor? We are located 1 hour north of Nashville Airport. Most of our patients are out of state. They fly to Nashville, they drive 1 hour. We're in Bowling Green, Kentucky, and they come here. We have a hotel across the street. Again, they come, usually doing their surgeries Monday, Friday, and then they fly back on the following Monday. That's what we do. What else? Celeste is asking, what is the aftercare of this procedure? So most of the times you're going to see us on the previous pictures, bruising, swelling, draining. The first week is like, expect the worst and you might not have it. And that's what I tell patients. The worst case scenario is like a lot of bruising, a lot of swelling, a lot of drainage, and extremely like tender to touch. That's kind of the first week. Now, this is kind of like the worst case scenario, and then you have people like they would walk in here the next day, they're like chilling. And I always give this example. One day I did 2 cases, very similar. They were about stage 2. We did like 360 lipo, same amount of tumescent, same amount of lipoaspirate. The surgery was both kind of, they did very same in surgery. They both came back the next day. One of them, extreme pain, like significant pain. See, like she's walking, she's standing up, and she's fine, she's walking. But you can tell, like on her face, like she's in pain. And the other one is like chilling. And I'm like, that's a perfect example because it's very subjective. Different people, they react differently. So that's why I cannot say like, oh yeah, it's gonna be great or it's gonna be super painful, because it's somewhere in between depending on how the person is perceiving and how the nerve ending of the lipedema patients are, because it's not all the patient, it's not all their brain, it's actually the inflammation that's happening around those sensory nerve endings. So that plays a big role. First week. After that, it gets better. Once you hit the 1 month mark, patients kind of tend to go back to regular. Great question. How long after surgery you're able to travel? 48 hours, and the reason for that is the drainage. A lot of our patients, they fly here, so once I had the patient, so I used to have them fly the next day. But unfortunately, we had a patient who went next day. She's from Canada, and if you're here, you know who you are. And they called me from Nashville Airport. They're like, "Yo, we've got this patient of yours," and now like she's fine. She's great. Did her surgery. I know exactly, great surgery. She looks good. Talking to her, she's fine. This is like we cannot put her on the plane because it's a biohazard because of the drainage from the tumescent. And you just can't argue that. And then, so we had her stay for the next day and then fly the next day. Now, that's why we have them stay for 48 hours, so the drainage is minimal. So 48 hours afterwards, patients can fly back. Angie is saying, I love the befores and afters. Thank you. And again, we are consistent. Like that's kind of like our before and after. Like, and I tell patients when they come here, it's like, at the end of your surgery, we're gonna take pictures and video, and I'm gonna show it to them. Like myself, I'm gonna show you the pictures and video. And if you don't like them, you let me know. If there's any area that you wanna touch it up, you let me know immediately on. And that's like, we're so certain, again, because we're so good at it, and we've done it so many times. We're at a point where, like, we know where we're gonna take the patient. So pretty much that's what most people expect. You know, like what they're gonna be, and if they need a touch up, we're happy to touch them up. It's not like we don't take patients from other surgeons who had surgeries but not somewhere else. But all our patients, we take care of them. Again, because I only do 2 surgeries a day, and that's it. So there is a limitation in terms of how much I can do. To maintain high quality, we have to be very limited in terms of whom we accept on as patients, how many we do, and the quality of patient experience. Not only the outcome, but also the experience. So we're very, very selective on whom we choose. I love the before and after, they are amazing. Thank you so much. Do you treat lymphedema too? From Lucy. That's a good question. Yes and no. And the reason I say yes is stage 4 lipedema. So you have stage 1, 2, 3, 4. Stage 4 lipedema. Let's say if this patient if this patient here doesn't do anything, she's stage 3 plus. When they advance to stage 4, it becomes lipedema, lymphedema. So it becomes lipedema and lymphedema. And that we treat it. If the etiology, if the cause of lymphedema is from lipedema, yes, we treat it. However, if somebody is coming to us with the etiology, the primary cause is lymphedema, we don't treat it. It's a totally different treatment for that. Usually lymphedema is like one leg, there's swelling in the foot and toes. It's a totally different disease than lipedema. But if the lymphedema is from the lipedema, then the treatment is the same, and then we do treat those patients. And that's another point where early treatment in lipedema is so important. It's so important, like once you know what you have, you just gotta treat it. It minimizes the chances of needing more procedures. The more lipedema fat, the more procedures. Chances of needing knee replacement, chances of needing vein procedures, like the gait, the mobility, psychological impact. I mean, it's really the sooner, the better. For both of us, for you and for us as well. Because like it's so much easier to do a stage 2 person than to do a patient who's stage 4 with lipedema, lymphedema, that they need 8 procedures. And now the skin is gonna be, so it's much easier to start it early. And unfortunately, most stage 4 patients, they didn't know about it 10 years ago. They had no idea what they had. And it's not their fault. It's just the medical system is not there. Even nowadays, like we are doing those lives every Tuesday and Thursday. So we're able to get the population and other physicians and other people to raise awareness about lipedema. That's part of our Instagram accounts. All of it, or 90% of it, it's towards lipedema education, educating about lipedema, what it is, what we can do, what's the solution, what's the treatment, all that stuff is around that. The more we do, the better. Motagi's Mitwa is saying, I live in Canada, how does this work? Same, I mean, you do a consultation with us, we actually have a fair amount of patients that come from Canada to us. I mean, we get patients from all over. We get from Europe. The other day we had one from Japan. So I was like, this is the first actually we had somebody. We get from Paris. With Canada, we get a lot. South America, we get a fair amount. And I do feel that, like, let's say, lipedema is genetics, right? So it's autosomal dominant. It runs in family. And I feel that are certain areas in the world, they are more prominent to have lipedema than are other areas. So just because it's a genetic disease, it can be, you see it more in certain areas and certain cultures more than other areas. So for Canadian, basically the way it works, they fly to Nashville, they come, it's kind of like the same concept. The main thing that we found it tricky with patients from Canada is the prescribing medications for them. Because we cannot prescribe like narcotics or Xanax kind of across the border. So what we do is we prescribe them here. So when they come here, they pick them up from a local pharmacy, then prescribing it at their own country. That's the main limitation for out of the country patients. But everybody else, like within the US, it's the same process. We prescribe it to their home state or hometown. Great questions, guys. Do you do new patient consultations over video call? Yes, we do. We the system we have is patients are not able to directly schedule a consultation. We have what's called the request consultation. So basically, you would send your patient paperwork and you would send the photos. The first one to see them is me. So I take a look and I want to see that first I want to make sure you do have lipedema, and I want to make sure you are the candidate for LippyLipo. And if that's a yes, then we move you to the second step for the consultation. And that's kind of like, so patients first, you request a consultation. We have the link in bio on Instagram, or you go to our website where you requested the consultation, you send me the information so I can take a look and approve. And then after that, you'll have the virtual consultation. And the reason, again, it's we really want to maintain quality. The last thing I want to do is have a patient who waited whatever time to get on a consultation and she's super excited just to figure out that she has lymphedema, or just to figure out like the LippyLipo, which is not a candidate for LippyLipo. Let's say if she's on a blood thinner, or she had a stroke like 3 weeks ago, or it's not a good experience for the patient. So as soon as I send it, within like a day or two, I send them back, say, hey, you're the candidate, you're good, let's move you to a consultation. And if they're not a candidate, we just let them know why they're not a candidate, so that they know and they're not like excited and waiting for their procedure or their consultation, and then we tell them on the day off, and it's just not a good experience. So again, quality outcome and quality experience is our like most important stuff, and that's how we restructure the entire operation. That's why we're like within one position, within one location. I do pretty much everything myself. It's from A to Z, it's me. Everything is like kind of like exactly like we know all the tiny little details, everything that needs to be done. That's how we're able to consistently get the outcomes that we're getting. Angie is asking, how do you know if it's lippy fat or just cellulite? When you look at the picture, lipedema fat, you see, if you look here, you see that, you probably see it better on this picture here. You see that cutoff sign? So basically, you have lipedema fat that goes down, and then the foot is normal. So basically, it's like a tree trunk appearance down to the ankle. This is all lipedema fat, and then the foot is normal. Cellulite is more, it's usually involving more like the buttock area, the saddlebag area. It's very, very different. Lipedema is tender. It starts at puberty. Patients have easy bruising. One of a family member, they have it, and mom, grandma, aunt. It can be on the paternal side, on your dad's side, because it's autosomal dominant, even though it's only in women, but it can be found on both mom's side or dad's side of the equation. Sometimes a daughter has it, it starts at puberty. So lipedema is totally different than cellulite. And again, we've done thousands and thousands of these cases, so by just looking at it, we're able to tell what the patient has. And looking at the new patient paperwork, when did it start? It starts at puberty, it gets worse with pregnancy, it gets worse with menopause, and the look of it. So you can easily tell whether it's cellulite or lipedema or lymphedema. How do I know if it's lipedema or just cellulite? Again, we just answered this question here. Namni is asking, you've probably discussed this in previous sessions, but how soon after surgery does MLD start? And thank you for answering my questions. I have a consult with you all scheduled this month. Yay. We're super excited for you. Very good question. So MLD, which is for the others, MLD is manual lymphatic drainage, which is the manual massage that's done after the procedure. At the end of your procedure, we expel all the fluid out, but that's not like a dedicated MLT. A dedicated MLT where you have a therapist, a specialist, who really milking that fluid from the interstitial system all the way to the lymphatic so the body can absorb that. We like to start that 1 week after the procedure. And then we do it twice a week. So we tell people like, the more the better. You want to get rid of that. We used to do it earlier, but we found when we've done it earlier, patients were tender. So now we have them leave the garment on for 5 days. Don't touch it, keep it compressed, keep the area compressed. We have them on antibiotics so it covers them to minimize infection. And then after the week, they'll take it out, make sure they're hydrated, and then they can start the MLD for that. And then you want to do it, the more you do it, the better. And the swelling usually is worse that first 1 to 3 months on most people, unless somebody is like stage 4 lipedema, lymphedema. Yeah, it's a different ball game, but regular stage 1, stage 2, 1 to 3 months usually swelling. So MLD twice a week, starting at 1 week after the procedure. Golly Massey is asking, which school did you finish your education? So I'm double board certified plastic surgeon. I trained at Yale, New Haven, Connecticut, and that's where I did my general surgery. And I did my plastic surgery training at Vanderbilt. That's why I'm in Bowling. It's like an hour north of Nashville. And that's kind of what I did. So Yale and Vandy, and I'm double board certified plastic surgeon. Where are you located? We are located 1 hour north of Nashville Airport in Bowling Green, Kentucky, from Quinton. Nomni is asking, do you also do lower abs? Absolutely. So we do, with LippyLipo, we do lower extremities, lower legs, upper legs, arms, axilla, and 360 trunk. And that's all what we do. We just do awake, LippyLipo for the, basically like, the areas that are involved with lipedema, which are usually arms, forearms, axilla, trunk, and lower extremities. Let's keep on looking here. Great questions. Siri Barron is asking, how about post-draining massages where that's so the manual lymphatic drainage or the massages. So we just talked about that, and it's like 1 week after the procedure. And you want to do them at your where you live, and you do it like twice a week, and you want to go to a certified specialist that are trained in manual lymphatic drainage, because really they expel that fluid. It gets you to your final outcome faster. It minimizes the amount of fibrosis you have. Compression is very important after the fact. So you gotta make sure, and this is great actually. You make sure you connect with that specialist before your surgery, so that you have it all set up, because most of them, they are booked for months in advance. So you want to make sure you are already, like you have a spot, you know where your procedures are, and then you have spots so that you can follow. And we're happy to share that with you, whatever they need information from us, we're happy to share that, because this is a crucial part of the recovery. We want to minimize the amount of fluid that the patients have. We want them to get to the best outcome possible as fast as possible. And MLD would help them in that. Amazing question. Do you have financing, or what payment method do you have? From Quinton. So we work with Care Credit and Patient 5. We're not in network with any insurance. We only do with about quality, and that's really all what we're on. And for us to be able to maintain the quality, basically that's we're like purely private practice, because I'm sure like the same questions are gonna get asked. What financing is usually Care Credit? The short answer to your question. And kind of like, okay, what carriers, what's that, the insurance, all that stuff. We're very, very limited, we're very selective in whom we choose. And the reason for that, it's really because I want to provide the best outcome possible and the best patient experience possible. And that's how we look at it. And talking about like pricing and financing, our prices are actually going up on February 1st. And I'm just telling that to the people who are here, because so you know, like from now till February 1st, the old pricing is gonna be there. On February 1st, those prices are gonna go up. So if you're thinking about it, do it, schedule it that before February 1st, because that's gonna change. Patient with the arthritis, rheumatoid arthritis, can do the liposuction. It's not correct. Patients, we've done patients who have autoimmune. Actually, it's interesting you mentioned that a lot of patients with lipedema, I've noticed that they have autoimmune problems, either lupus or rheumatoid and that's something like I talk with my colleagues about. It's like, it's interesting, I was talking to my wife, she's a primary care physician, and I was like, you know, I've seen that because I look at a lot of new patient paperwork that comes to us with patients with lipedema for LippyLipo, and I noticed that a lot of autoimmune diseases, so a lot of our patients have rheumatoid arthritis, have lupus, have certain autoimmune problems, thyroid problems that we deal with. So it's not a contraindication for LippyLipo. Amazing questions, guys. Michelle is asking, are the cannula entry points similar to venous ablation incisions? You know, that's a good question. There's different things about venous ablation. Some people, they go wider, some people so on. But I'll tell you this, the cannula entrance point, it's a 2 millimeter. It's like that, literally, it's a 2 millimeter punch, like tiny, tiny little one. that after a year, most patients that like almost totally fade away. It's not zero, it will always be there, but you gotta really look for it. Unless somebody like hypertrophic scarring, keloid, hyperpigmentation, stuff like that, it might take them more than that. But most, I mean, look at this patient. You can't, like, she's 1 year post-op, you really have to look close to see the biopsy side, the punch side. Here you see it's more, she's 2 months post-op. You see it's more on this one than on that one. This one's like almost fade away at 1 year post-op. So they really heal very well. The key for those is like making the entry site so small, just big enough so that the cannula can go in. Any bigger than that, it tends to show more. So it's very crucial. Again, and talking about that, we use micro cannulas. We don't use regular cannulas. And this is important. And that's how we're able to get this outcome, great cosmetic outcome. It does take us time. It takes us 3 to 4 hours to do a case, but we're using tiny little cannulas, micro cannulas, curved cannula that I kind of like personally like bend and move and have the holes on different sides. Part of the LippyLipo technique that I use to be able to get the outcome. And when you're using micro cannula, the punch, the site of entry is much smaller than using not micro cannula for LippyLipo. Good question. Let's keep on going here. Which specialist diagnosed? Doctors in Virginia don't even know what this is, from Siri Barron. And unfortunately, not only in Virginia, this issue is like across the world, really, and not even only in the US, because I do get a lot of consultation from overseas. You don't need an official diagnosis, you know. And if you're at home, you're not sure, I'm happy to help. Send us your pictures, your new patient paperwork. Even if you're not interested in the procedure, I can take a look and tell you if you have lipedema or don't have it. So that to help you on this side. But let's help the general patient, the people who are like, they're not sure if they need to go to somewhere to get, you really don't. I mean, it's good to have it, but there is no need. You would know. Easy bruising, runs in families, 3-trunk appearance, starts in puberty, gets worse with pregnancy, tenderness, heaviness at the end of the day, late stages, people can become wobbly because of the effect on the nerve endings. These are all lipedema presentation. Angie is asking, how do you keep lipedema from coming back? After the procedure, having a healthy lifestyle is super important. We know like lipedema gets worse with hormonal changes. So a lot of people that's why I tell them, get the procedure early on. Like if you're about to get menopause, get it before menopause. If you're gonna get pregnant in the next 5 years, get it before you get pregnant, because it's gonna get worse. So that's kind of how you minimize the chances of progression. After you get through your procedure, lipedema diet, anti-inflammatory diet, low sugar. Sugar is not good. Like low carb, low sugar diet. You know that's been helping a lot of patients with lipedema. Being active, all that stuff minimizes the chances of recurrence. More we use the word of regrowth in lipedema. Again, very, 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 very low risk of that if patients maintain healthy lifestyle after that procedure. We rarely see regrowth. I don't want to, it's not zero. I've had a good friend of mine who also has lipedema. She lives in Europe. And she's big in the lipedema world. She had her lipedema surgery done about probably 10 years ago in Europe. And over there, I think the first surgery, they didn't take all the lipedema or most of the lipedema fat cells out. So she had regrowth. So the question is, if they did what are the odds of regrowth? So really, again, it goes back to going to, because you want to maximize your chances. The way to maximize your chances is getting the best cosmetic outcome, cleaning the leg, taking as much out lipedema fat cells as possible and maintaining beautiful shaped legs. That's how you minimize your chances of regrowth the most. And maintaining a healthy lifestyle. Good questions. Goli is just asking, can you see my questions? If I have missed it, please ask it again. I'm going through the list and I'm answering every question that I see. So Goli, if I missed your question, please ask it again because I'll get to it as I'm scrolling down. Patient arthritis can do liposuction who have lipedema. Yes, if you have lipedema and you have arthritis, you can do your liposuction. It's actually, a lot of people end up with knee replacement who have lipedema. The problem is not the damage to the knee happened because of the weight of the lipedema fat cells. So if we give them a new knee and we don't treat the problem, guess what's going to happen? They're going to need another knee. So really the treatment is fixing the lipedema, LippyLipo first, then the other stuff. So important. Manal is asking, do you prescribe blood thinner injection after surgery? And what about MLD after surgery? We don't prescribe blood thinner for most of our patients. Unless, let's say, somebody is hypercoagulable, they have a history of blood clots, certain things about them that puts them at a high risk, yes. But otherwise, there's no need. Again, LippyLipo with awake, the chances of blood clots is significant. It's a different ball game than doing a general anesthesia, than doing a thigh lift, than doing a Bobby makeover, than doing a 360 lower body lift. Those, yes. LippyLipo, no need, unless there's an underlying hypercoagulable state that they would need that. And to answer your other question, Manal, what about MLD after surgery? After a week from surgery, twice a week. MLD is crucial. Manual lymphatic drainage, get rid of all that fluid, is super, super important. Kelly is asking, how much is the surgery? For pricing, DM us and we'll tell you kind of like the starting cost. But that being said, for our pricing, they are going up on February 1st. So if you're thinking about it, guys, that's your window. And I'm saying that just since you're here and you're on the live. On February 1st, our prices will be going up. Chris is asking, what if I live out of state? It's very simple. Actually, 90% plus of our patients are outside our state. They either drive to us if they are within like 4 hours, and if they're more, they fly to us. With 1 hour north of Nashville Airport. So patients, they fly to Nashville, they drive 1 hour, get their surgery done, and then they fly 48 hours after that surgery. Most of them are getting two procedures done, one done on Monday and the other is done on a Friday, and then they fly back on Monday. This way they get like up to that 10 liters, 5 to 10 liters. Most patients, they need 2 procedures. Unless they have like stage 3, 4, then they will need more than 2. Then they do the 2, then we give them 6 weeks in between, they come back, and then we do the other 2. Great topics here. I have seen you have clients from Colorado. Can we fly? Is there more than one location? We have one location, located one. We used to have 2, but again, with the volume that we're having and kind of all that, we had to restructure. So now we are in Bowling Green, Kentucky, 1 hour north of Nashville. Our patients, they fly to Nashville, come to us, and then you can fly back 48 hours after your procedure. Do you recommend about Jova, do you recommend any specific MLD therapist, or do you have a specific therapist you work with? That's a great question. We operate on patients across the world. So what I tell patients, like, look in your local area and see who is a therapist that are certified in MLD, and it's better if they have a lipedema background. And you want to book your appointments with them even before having your surgery done, because most of these therapists, especially if they are good, they are fully booked, and they're booked like months in advance. So you gotta make sure you've got that on the schedule, so that when you get your surgery and then you fly back, then you're getting that done, because it helps a lot. I mean, it gets you to your final outcome much faster, minimize the chance of potential fibrosis, it gets rid of all that fluid. I'm a big fan of MLD after the surgery. Now, that being said, I've had also patients where they had an amazing outcome without MLD. It's not like, if you don't have it, oh my God, it's not the case. But I feel patients with MLD tend to get to their final outcome faster. The chances of fluid collection is much less because they're, getting rid of that fluid. So it makes the recovery easier and the outcome potentially better. Siri is asking, insurance covers this procedure if one is diagnosed with lymphedema. I think whether lymphedema or lipedema, some carriers are covering lipedema cases, and some do not, depending on the carrier that you have. Obviously, you need to they have you have to check certain boxes that they need and all that stuff. We did have few of our patients. We're not in network with any carrier. We're not in network with insurance. But some of our patients whom we operated on, they went back to their carrier and then they filed for that, and they were able to get approved kind of after the fact. So we've had some patients who were successful in doing that. But again, we don't file for the insurance. We're not related to any insurance. White Jack is asking, how much does it cost for legs liposuction? For pricing, please DM us and we'll start you the starting cost. But I'm telling you, as of February 1st, our prices are going up, so you know. Chris is asking, is the procedure painful? We have three types of patients. Certain patients where the procedure is and they feel it on the numbing part. After it's done, patients don't feel there's not much tenderness. Now, the numbing part, the three types of patients. You have the patient population is kind of in between. It's not bad, 6/10, 5/10, kind of in certain areas. Some people were like, oh my God, this is really, it's hurting a lot. And then you have some people who were like, we didn't feel anything. And it's a bell-shaped curve. 80% that kind of fit in the middle. You have 10% that they're just chilling, they're just chit-chatting, FaceTiming their friends. And I'm like, oh my God, they're doing so well. And then you've got the other 10% of people that are they're squeezing, they're pitching an implant, they're on the Pronox. And it's very hard to tell. I can tell the first minute of the procedure as I'm injecting the numbing, kind of to make those tiny little poke holes for the lipo cannulas. Then I can tell how they're gonna do. Again, I've done thousands of these cases at this point. Thank you from Siri. You're welcome. Kelly is asking how much is the surgery. We just talked about it. Again, our pricing, guys, are going up in February, and February 1st, I'm being totally open about it. After pregnancy, how long after can I get the procedure? You want to wait for about 6 months afterwards, and the reason for that is the hormonal changes. With pregnancy, there's a lot of hormonal changes. You want your body to kind of go back to where it needs to, but 6 months after the fact, you want to do it. Obviously, no breastfeeding. Kind of make sure you set up your body for that, but you can do it at that point. And again, especially if you're planning on future pregnancies, really what we found is lipedema, it starts at puberty. It gets worse with pregnancy. I mean, it does. That's how lipedema. With every pregnancy, it tends to get worse and worse and worse. And then when it comes around menopause, it gets worse. We've seen it getting worse on patients who had GYN surgery, where the ovaries are removed and hormonal changes. It gets worse. So all that stuff, it tends to get worse. Kath is asking, will you do lipo on the front of the leg too? Yes. So when we do lipo, we're doing 360 lipo. We're doing 360, so front, back, sides, 360 around the ankle, 360 around the calves, 360 around the knees, the thighs. I mean, we're treating the entire, because clothing is 360 degree, the body is 360 degree. So really everything is not just we treat the entire body. Arms, forearms, axilla, trunk area. It's all 360 degree liposuction. So yes, we do treat the front. Katie is asking, can there be less incisions? The answer is yes. So there is, like everything in life, there is a sweet spot. Too many incisions, too much of those pinpoint. It's not too good. Too little incisions, too much contour irregularities. So you want to make enough incisions to have the best outcome possible with the least amount of incisions. And that's how we got to these incisions. So I had a huge Excel sheet where I would have high incisions, very low contour irregularities. Very low incisions, higher contour irregularities. And then after doing thousands of these cases, I kind of figured out exactly how many incisions to do to have the least amount of contour irregularities to do. So, good question. Again, guys, so crucial to go to an expert for these. It's so, when I look back at my journey, I'm the amount of things that I do different, and that's me who's super, I was born to be doing lipedema cases, right? I mean, that's in my DNA, in my genetics. But the amount of growth that I had to go through, and the amount of changes and kind of analyzing and stuff that I had to do is huge. So to get to this point, it took so many things. So it's, again, like that's why I like, make sure you go to the right person. And that's the other thing, we don't treat patients who are treated by other physicians. So you get somebody down there, got that, I mean, it's just, again, very selective on whom we choose. So make sure you do your homework. Do you tighten the skin too? We do with LippyLipo. Every patient gets skin tightening at the end of the procedure. It's organic, mechanical tightening using LippyLipo. So the answer is yes. We don't do skin resection, like skin removal, like thigh lift and that, because of the risk of complications with those, and most of our patients are out of state, so we have them go back to their hometown or to their city, and we'll have them done locally there once they're done with their LippyLipo. Great questions. I know it's been an hour, and I do have like amazing merci. Okay, I think I know who you are. You're welcome. About Jova. That's Danny is saying, is the procedure high risk when the legs have varicose veins? You know, that's a good question. We perform, it was a big kind of like discussion in the past, like, oh, shall we treat the varicose veins first or treat the lipedema first? And we've done it both ways. Now we treat the lipedema first, because what we found is when we treat the lipedema first, the varicose veins tend to get better, because sometimes those veins, it's not a valve issue, most of the times it is. If it's just pure varicose veins in somebody who doesn't have lipedema, the problem is regurgitation. It's like backflow into the superficial system. From the deep to the superficial, that's how they get the varicose veins. But in lipedema, what I found is sometimes the fat cells are pushing on the system, and that's how patients are having varicose veins. You treat the lipedema, the varicose veins gets better. So our patients, we treat the lipedema first, and if they're still having varicose veins, we'll have those treated by vascular surgery at a later date. Now, to answer your question, does it make it higher risk? In my hand, doing hundreds and hundreds and hundreds of these, it hasn't. It's kind of like the same risk. The key though is good tumescent, giving it time for vasoconstriction, using the right cannulas. That's how you minimize the chances. Very good. How long does the procedure typically take, provided there are no complications? Again, complication rate is like so minimal. Like, so minimal. With awake LippyLipo, I mean, it's like, because it's awake, it's so safe. You know, it's just like, most what we see is bruising, swelling, tenderness, that first week. That's pretty much like, that's really what we see with LippyLipo. Now again, it's not zero, you know, obviously, you know, it's still a procedure, it's still surgery, but it's like one of the safest cosmetic procedures and functional procedure that we do. How long does it take? It takes 3 to 4 hours. Now, ankles, calves, and knees takes longer than thighs. So the ankles to knees is usually 3 to 4 hours. Knees to thighs is usually about 3 hours. It does take time, because to get an amazing outcome consistently, it does take time. And that's why we only do 2 procedures a day. Curly is asking how many days I can go back to work. Usually I tell people 1 week, and then you'll be able to go back. Compression is key that first month. Nami is asking, how far down the ankle do you go? If I have lippy spots just inferior to my ankle on my foot, do you suction that? I mean, that's an amazing question. So actually, a lot of lipedema patients, they have 2 lipedema nodules or fat pockets that sits on, even though we say the foot is spared, it's actually not. Most lipedema patients here and here, on the outer aspect of the foot, on the dorsum aspect, there's 2 fat pockets. Especially when they go to stage 3, stage 4. They have lipedema fat cells that sits there. And yes, I do treat them with LippyLipo. It goes below the ankle. I use a microcannula, a curved microcannula that allows you to go over the ankle, around that, go down to that pocket to suck it out. Very good question. This is like advanced. I usually don't talk about it, but since you asked these questions, we do that as well. Again, late stages, they do have it, and it's important to treat it because of shoes. Like, especially if somebody they want to wear like thinner shoes, and if that part, the dorsum of that foot, those lipedema pockets are too large in stage 3 and 4, then you gotta treat them, otherwise the shoe's not gonna fit well. Looking at that 360-degree approach, it's so crucial. one of the question here from Sloan is asking, if planning multiple procedures, should I do legs first before trunk and breast procedure, or does it matter? You know, that's a great question. There's no right or wrong. I usually tell patients start with what bothers you the most. That being said, I found when people treat their legs first, their mobility is better, they're happier, they tend to be more active, and they lose more of the normal fat. So it makes the amount of lipedema fat or lipedema or LippyLipo procedure much less. So I tend to say, okay, do your legs first, you're gonna feel better and it's gonna help you on the long run. But the scientific answer, it doesn't really matter. But my experience, we tend to do knees, calves and ankles, thighs, and then we go to other area of the body. Namni is saying that's exactly what mine are. You're totally right. So you're probably kind of within that stages. It sits kind of on the, and I think you're talking about the two fat pocket that sits on the dorsum of the foot, on the outer side, two pockets kind of below that bone, below that ankle, and they're kind of sit next to each other. And again, with LippyLipo, microcannula, you can get to those and you can suck them out. Diane is saying, where are you located? Located 1 hour north of Nashville Airport. Fatima is asking, I have issues with my hips down to my calves. And again, like if you send us your pictures, I'm able to tell if you have lipedema or not. And if you do, we can recommend like how many sessions you have. How much pain is there with awake lipo? Really, like there's 3 different types of patients. Some patients don't feel anything. Some patients, like, you know, they're really feeling the numbing part. 80% of patients, it's like 2 to 4/10. And that's kind of like, it's a bell-shaped curve. Once it's numb, patients don't feel anything. Sloan, thank you as well. Fatima is asking, should the LippyLipo be done after being done having babies? If that was a family member, I would do the LippyLipo before having babies. Because with pregnancy, we know for a fact, pregnancy makes the lipedema fat advance. Potentially, it can get worse. And you want to treat it sooner than later. So, my advice is, whenever you know you have lipedema, treat it. It's like having like a tooth cavity, you know, like you don't want to wait until like it's an implant and that, you want to treat it like early in the process. I have lymphedema and lipedema from Norway. Do you do patients with both? So we treat all lipedema patients and lymphedema patients who progress from lipedema to lymphedema. So stage 4 lipedema is lipedema lymphedema. So if somebody comes to stage 4 who developed lymphedema because of lipedema, yes, we treat them. But if somebody is coming with lymphedema without lipedema, that's a totally different etiology. We don't treat that. It's a different treatment. Crystal is sorry guys, we're getting a lot of questions, which is great, but they're going, if I miss one, make sure you write it again, so because I want to answer every single person here. Might is asking, how far between can you have round 1 and round 2? So usually for our patients that are coming out of stage, we do Monday, first stage, Friday, the second stage. Then they fly back if they have more than 2 procedures, and then they come back 6 to 8 weeks afterwards to do stage 3 and stage 4. Crystal is saying, I am a great before picture for you. How do we set up a consult? To set up a consult, follow the link in bio, and then you can send us your, you can request a consult, send you patient paperwork and photos. Diane is saying, I have some health issues, hypothyroidism, pre-diabetic and high blood pressure. Can this affect any surgery and effects on it? You know, that's a great question. Again, the beauty about LippyLipo being awake, the risk that we usually would say no to people under general anesthesia, it allowed us to help more people. Whether the BMI is higher than 35. Because a lot of lipedema patients, they have a higher BMI, not because they have higher BMI, but because it's falsely elevated because of the weight of the lipedema fat. So because since they're awake, it takes the risk of DVT, PE, positioning, brachial plexus, all that out of the equation because it's LippyLipo. Same for the other stuff. So if you send us your information, there's really no, I mean, the major contraindication if somebody had a heart attack like a month ago, or somebody is on a blood thinner, or somebody is really like healthy, they're not able to carry like normal function, these are not a candidate. But for most other patients with LippyLipo, they are candidates for the procedure. Angie's asking, if I only can afford one treatment, but it's ideal in my case to treat with 2 procedures, how do you prioritize with area to treat with only 1 procedure? Great question. If you can only afford one, do ankles, calves, and knees, because you build the infrastructure. And you gotta have like good ankles, good calves, good knees, and then do the thighs later. And the reason I said that, it's very easy to get to 5 liters in the thighs, and then you leave the knees, calves, and ankles, and this got enlarged. It's much harder on mobility, much harder on stuff. So I can only do one, do the ankles, calves, and knees. Even though it's a harder surgery, harder recovery, and it takes longer for us to do, it's the right thing to do. Angie's saying, same situation here from Dunya. Namni is saying, I heard you mention Xanax or use of Ativan while inserting the numbing. Do you do twilight? That's a great question. We do awake LippyLipo, and I'll tell you exactly what we do. We give 1 milligram of Xanax and 1 tablet of Percocet. That's it. There's no IV sedation. There's no twilight. Just like purely awake. And I love that because it's safe. Patients are able to move around, they're part of the decision making, they're walking immediately out. It minimizes any complication rate, it keeps us in the safe plane, and that's the way to do it. Chris is saying, if a patient's on semaglutide, how long do I need to stop before I have surgery? Normally we tell patients 2 weeks, and again, with awake LippyLipo, really, normally we tell people to stop those because they're going to go general anesthesia, it delays gastric emptying. There have been reports about higher risk of aspirations patients under general anesthesia with these medications. But again, with LippyLipo, you're awake. I mean, it doesn't matter. People are drinking the morning off, some of them are having coffee, and some of them are like chit-chatting. You don't want to have a lunch, breakfast. Obviously, we're still doing procedure, but it minimizes that chance significantly. But the right answer is 2 weeks. Is it normal to have heat in the area where liposuction conducted? It's a very general question. It's tough to tell. Like, how far after the liposuction? Is it like 1 week? Is it 1 year? Is it 6 months? So we gotta be specific in that. And the pain sensation and the heat sensation, the nerve endings, immediately after the procedure can change. So potentially it can. But again, just answering that question, I cannot give you exactly the answer because I would need more information about that. All right, guys. I mean, this is awesome. It's been a great session. A lot of questions. Let's do another set. I mean, we'll be live again on Thursday. We go at 12 o'clock, Tuesdays and Thursdays, Central Time. Any questions you have, come here. I'm happy to answer any questions you have. Anything related to LippyLipo. That's our goal, to provide as much information as possible. And as always, thank you for watching and thank you for being here.